Hi, my name is Gena Donahue, and I'm the controller at the Roanoke, Virginia sheep plant. I've been with Pratt for just a little over 2 years. I love my job and I love the people I work with. So when I was asked to share my story of COVID, I was more than happy to help. Like many of you, I was hesitant to receive a vaccine that we knew so little about and had no history of any long-term impacts. However, because my husband was recently diagnosed with cancer and as a result had a compromised immune system, my family and I decided to get vaccinated for his sake. So I signed up for the vaccine and waited to be called. I came to work one Friday morning, feeling great. As the day progressed, I noticed that I was getting the sniffles and a minor cough. I really didn't think much about it since her pollen count was extremely high and I have allergies. I had no other symptoms than a minor cough, which I still attributed to allergies. I was so wrong. 2 to 3 hours later, my cough was worse. I had developed a fever and I felt horrible. I left the office and went directly to an urgent care facility for COVID testing. At that point, I wasn't really surprised that my test was positive, but I still thought this was going to be basically an inconvenience and I'd feel bad for a few days. Wrong again. The following day, I asked my husband to take me to the ER. Little did I know that I wouldn't see him for weeks after. The ironic thing is, I was scheduled to take my vaccine the following day. According to my medical team and family, my lungs continued to be less functional by the hour. After a few days of this, I was put on 100% oxygen and was put into a medically induced coma with no certainty that I would recover. In fact, my family received 2 phone calls during my stay, telling them that I wouldn't make it through the night. The thought of my family receiving those calls and dealing with that news is almost unbearable for me. If you've ever wondered if comatose patients can hear what's going on, I did. I think I heard most everything going on around me, but I couldn't respond and I had no real context for what was happening. I felt no pain and had no awareness that I was ill. I heard the medical staff talk about my condition worsening and the likelihood that I would not get better. I didn't understand. And of course, I could not have any visitors, so was completely cut off from what would typically be the emotional support that I believe any patient needs to fully recover. My medical team told my family that I had the worst case of COVID that they had seen, and my recovery was nothing short of a miracle. My recovery has not been fast, and it's not been easy. I was in the hospital for a total of 7 weeks and on a vent for approximately 18 days. While I was in the hospital, I had 5 surgical procedures and 2 types of pneumonia in both lungs. I experienced a major arterial bleed in my abdomen and was losing blood almost as soon as they gave it to me. When they found the source of the bleed, they were able to correct it surgically. Due to some of the medications they had me on, I had hallucinations and for a while couldn't distinguish between dreams and reality. I was confused for a very long time. Because some of the drugs to treat COVID caused blood clots, my legs were, according to the doctors, full of clots. To prevent the clots from going to my heart and lungs, they surgically inserted a filter. I am currently being monitored once or twice a week by an anticoagulation clinic to have my blood clotting factor tested. To date, I'm still having some issues getting my blood in the proper range. This puts me at risk of additional clots or uncontrolled bleeding. The plan is for me to have follow-up surgery later this fall to remove the filter once it's safe to do so. When I was brought out of my coma, my doctors told me I couldn't walk and would have to go to therapy to relearn basic motor skills. I definitely didn't understand that and didn't believe them until I tried turning over in the bed and couldn't. It took weeks of very intense therapy before I could walk more than a few feet, and then only with a walker. I have never felt so dependent in my life. I was unable to care for even my most basic needs. That was extremely difficult for me. With the loss of motor functionality, I couldn't write my name, or even hold my cell phone to call my family. Part of my PT and OT focused on regaining enough strength in my hands to write my signature. When I woke, I quickly realized I'd lost my ability to speak loud enough for anyone to hear me. My vocal cords had been damaged in the intubation. That made for some interesting phone calls and was very frustrating. And while my voice has improved significantly, I still don't have full functionality yet. My speech therapist told me it could be months. While I realize that vaccines are a personal choice, I want to encourage anyone who is on the fence to consider getting yours. It may save you and your family from an experience like mine. Thanks for taking the time to listen to me.